Hello friends and the sickle cell community, it's me again, Dr. Adeyemi. Welcome to another episode of Let's Talk About Sickle Cell Anemia. Today we'll be looking at interesting conditions that can occur in sickle cell anemia, and we'll be looking at acute complications of sickle cell anemia. One of the most serious complications of sickle cell anemia is bone pain crisis, and this occurs as a result of vasoocclusion, or when there's an occlusion in the blood vessel that leads, that supplies the bone. This leads to a shortage of blood flow in the bones, causing ischemia, causing infarction, and causing serious pains, in people living with sickle cell anemia. Today, we'll be looking at other types of conditions associated with vasoocclusive events in sickle cell anemia. Let us note this. I'm not in any way trying, to underscore or subdue the effect of bone pain crisis. Bone pain crisis is very, very serious, bringing serious pains, to people living with sickle cell anemia and also to their families. But is that the only thing we need to worry about in vasoocclusive episodes in sickle cell anemia? Today we'll be discussing about other conditions, that are associated, with vasoocclusive events in sickle cell anemia. Top on the list is strokes, or what we refer to as cerebrovascular accident, in the medical parlance. This typically occurs when there's occlusion in the blood vessels that supplies the brain. Sometimes it may occur as a result of bleeding in the brain as a result of repeated vasoocclusion in the blood vessels, that occur in the brain. Depending on the area of the brain when this occurs, you understand, it can make someone living with sickle cell anemia, when it happens, not able to carry either an area of their hand or their legs. It can change their personality if it's happening in some other areas of the brain. It can make them have learning disabilities, and sometimes they may have behavioral changes as well too over time because of what we refer to as multiple silent cerebral infarcts. This can also make them prone to seizures, convulsions, as a result of multiple vasoocclusive crises that has occurred, in different areas of the brain. When there's an acute condition, when there's an acute occlusion of blood vessels in the brain leading to a stroke, this is a serious medical emergency, and parents living with children that have sickle cell anemia have to pay particular attention, to their well-being, and also notice early symptoms, related to having strokes in sickle cell anemia, especially when they have serious headaches and then they are also not able to lift one part of their hands or their limbs. You have to take them to the medical emergency where they need urgent medical intervention. Another serious condition that can occur due to vasoocclusive episodes in sickle cell anemia is what we refer to as an acute chest syndrome. Now, acute chest syndrome can occur when there's a vasoocclusion in blood vessels in the lungs leading to lung infarction. It can also occur when there is a prolonged bone pain crisis in which some areas of the bone gets infarcted, especially the bone marrow or the fat spaces in the bone, gets infarcted and then is carried by the same blood vessels, to larger blood vessels, especially in the lungs, and then lodges into the lungs. This is what we refer to as embolization. So acute chest syndrome can occur as a result of either chest infection, can occur as a result of either infarction of the lungs, can occur as a result of fat embolization or necrotic marrow embolization to the lungs. This gives them a sudden onset of chest pain, shortness of breath, difficulty in breathing, rapid breathing. Some may have a fever. Once you notice these symptoms in someone living with sickle cell anemia, that is a sign that they require immediate hospital admission and immediate medical attention as well too. The third serious condition that can occur as a result of vasoocclusive crisis in sickle cell anemia, this one typically occurs in males because they have a penis. This condition, we call it priapism. Priapism in the medical parlance, we call it a sustained, purposeless, and a painful penile erection because this is not stimulated by sexual desire or any form of sexual activity. It just occurs as a result of occlusion in the vessels in the penis, leading to obstruction of the venous drainage in the blood vessels that supply the penis, and that's why they have a stuttering or a prolonged penile erection. This is a serious condition. It's very painful, and if it is not managed properly, it can give them erectile dysfunction and may subsequently cause impotence in them. So once you notice you're having a sustained period erection that is lasting more than 30 minutes up to 45 minutes, 1 hour, and is not resolving, you need to quickly rush to the hospital, because this is also a serious medical emergency that needs to be attended to in people living with sickle cell anemia. Now, I haven't spoken about vaso-occlusive episodes in sickle cell anemia. The other types of crisis or acute complications that can occur is what we refer to the anemic crisis as well too. Now, this is what makes sickle cell anemia lives up to this name, anemia. Now, one of the anemic crises is what we refer to as hyperhemolytic crisis. In hyperhemolytic crisis, there is an aggravated destruction of red blood cells in patients or in people living with sickle cell anemia. Now, because the sickle cells are friable and they are not as strong as normal viable red cells, they get easily destroyed when they are flowing in the blood. Sometimes the systems we call reticuloendothelial system, which is responsible for the immune function, of the body that fends off infection, pick up these sickle cells and destroy them rapidly in a way that the bone marrow cannot compensate for the degree of destruction. Now, this is evidenced by looking into the eyes of someone living with sickle cell anemia. We see that the eyes are getting deeply yellow. You can also see them passing what we refer to as a Fanta-like urine or Coca-Cola color-like urine. Sometimes they may also have circulatory collapse as a result of rapid destruction of blood, and then they have symptoms and signs associated with anemic heart failure. This is also an urgent medical emergency, and they may require they will require hospital admission, blood transfusion, and other things that will be done for them to bring them out of these episodes. Another type of anemic crisis is what we refer to as sequestration crisis. Now, sequestration, by the name sequester, it means pulling of blood, from the body into organs like the spleen, the lungs, and the spleen and the liver. In patients, sickle cell patients that still have their spleen, usually in children and younger adults, and about 15 to 20% of them that might still keep their spleen up to adulthood, they typically have this condition referred to as sequestration crisis, where the spleen, aggressively pulls blood from the circulation into itself. Now, this leads to rapid expansion of the spleen, leading to increase in abdominal size, and as a result of the rapid pulling of blood, they might develop symptoms such as weakness, generalized body weakness. They feel tired. Sometimes they have shock-like syndrome. Sometimes they may collapse as a result of circulatory collapse. They may have hypotension, and some may also develop signs and features of heart failure. This is also an acute medical emergency, and if you notice any of these symptoms, especially if you are living with sickle cell anemia, you have to hurry to the emergency so that it can be taken care of and to forestall any further morbidity or mortality that could arise as a result of sickle cell anemia. Now, the other type of anemic crisis is what we refer to as aplastic crisis. Aplastic crisis typically occur as a result of a viral infection, parvovirus B virus infection. Now, this virus infects the precursors of red blood cells in the bone marrow and causes what we refer to as a shutdown of erythropoiesis, that is production of red blood cells. Now, this may be temporary, but typically may last between 2 weeks to 4 weeks. But during that period, when there's reduction or no production of blood at all, people living with sickle cell anemia, also develop symptoms like shortness of breath, weakness. They may have hypotension as well. They may have signs and features of heart failure. And during this period, they will require medical intervention to keep them alive until the infection passes or the body is able to subdue the infection and then bring them back to normalcy with medical intervention. Now, I haven't spoken about acute complications of sickle cell anemia. It is very, very paramount to also know that there might be other complications that are also associated with sickle cell anemia, and these ones we refer to them as chronic complications. Now, we'll not be talking about chronic complications of sickle cell anemia in this video, and then subsequent episodes of Let's Talk About Sickle Cell Anemia, we'll be looking about chronic complications that can occur in sickle cell anemia. Let us remember, the less the vaso-occlusive events in sickle cell anemia, the healthier you are, the healthier the lungs are, the healthier the heart is, the healthier the brain is, the healthier you are generally. So that is why it is very, very important to keep to your clinic schedules, to take medications as prescribed by your doctors and by the hematologist. And parents living with children that have sickle cell anemia have to pay keen attention, in observing everything that happens to their children. You have to pay keen attention to their food. You have to pay attention to the water requirement, every day. You have to pay attention when they are sleeping as well, to keep an eye on them while they are sleeping. If they are sleeping, their mosquito-treated mosquito nets or insecticide-treated nets, pay particular attention to them. Check on them from time to time, so that you can easily pick signs and symptoms, and then quickly bring them to the hospital so that you can forestall complications that can occur in sickle cell anemia. Having spoken about these complications, I hope and I pray that we all keep to our daily requirements, everything that we have to do to avoid triggering sickle cell anemia, and wish us a happy life, a healthy life as well too, and live purposefully, as with sickle cell anemia. Like I always say, living with sickle cell anemia is not a death sentence. You have to find your purpose, you have to own it, and you have to let your story encourage others as well too. And let us all in the sickle cell community have a happy life. Thank you for listening. Please, if you like this video, share, subscribe, comment on these videos, and then also leave comments about your experience living with sickle cell anemia, so that we can use it to guide others, and also to encourage oneself or others as well, one another rather, as the day goes by. Till another episode of Let's Talk About Sickle Cell Anemia. Do have a wonderful time. God bless you all.